Wax removal has to be done by somebody who is trained, who knows the anatomy of the ear canal, so that injuries can be prevented. It can, on seeing if there is even a minor amount of gap between the skin and the wax, we can use either a hook to remove it. It will look a bit scary, metallic probe going into your ear, surgeon trying to remove it, but then he is trained, he or she is trained, and then they have good illumination because of the lights that we use in our clinics. I am Dr. Sreenivasa Murthy TM. So, can earwax cause infections? By themselves they don't, but when they get accumulated to such an extent that they put pressure on the skin, causing damage to the skin, then they can get infected. In an attempt to remove the wax, people may use earbuds, people may use a pin, safety pin, they may use certain sharp objects to try and clear it out. Inadvertently, they may injure the skin, and then it can lead to secondary infection. Why we recommend not to use earbuds is it is totally against basic physics. Our ear canal is like a cylinder. You have wax which is smearing all around the skin. You are using another cylinder to try to remove it. So basically, when you put one cylinder in a cylinder and make a circular motion, like it is like a screw being tightened. So what happens, all the wax which is there on the skin will tend to go get accumulated in the center, and the earbud will tend to push it deeper inside, and then it will go and get stuck onto the eardrum. And in that process, if the earbud is snugly fitting into the ear canal, it can actually cause scratches on your ear canal skin and then lead to secondary infection, bleeding, pain. So that's the reason we say don't use earbuds. If you have to use earbuds, it is only to clean the wax which is visible to your friend or partner or somebody in the house to the outer part of the ear canal. Only that part needs to be used with a bud to clean. And so impaction of wax generally happens either because of buildup. Over a long period of time, person would not have felt any symptoms and would not have attended to the wax buildup, and suddenly one day when water enters in the ear, they will suddenly feel everything clogged up and it gets impacted. And over that, to get relief, if somebody has used a bud to try and remove it, it may tend to pack it deeper into the ear canal and then it gets impacted. And in that process, if they have infection, then it becomes doubly difficult. We will have to attend to the infection first, get the infection under control, all inflammation should come down, and then the wax has to be removed. So how is wax removed? So wax removal has to be done by somebody who is trained, who knows the anatomy of the ear canal, so that injuries can be prevented. It can, on seeing if there is even a minor amount of gap between the skin and the wax, we can use either a hook to remove it. It will look a bit scary, metallic probe going into your ear, surgeon trying to remove it, but then he is trained, he or she is trained, and then they have good illumination because of the lights that we use in our clinics, and we are trained to know the anatomy, so it is generally a safe procedure. But if it is totally packed, very hard, then what we generally do is give some wax softness, use it for maybe 4 or 5 days, and then make it entirely soft so that it can be actually suctioned out. When we say suctioned out, we use a mini vacuum cleaner like instrument, and we will irrigate the ear with some liquid so that in a liquid medium, a soft material can be suctioned off. That means, because using negative pressure as a principle, everything can be taken off. Now this can be done with a headlight. Sometimes when I actually feel it is very deep, the impaction is very close to the eardrum, then I even use magnification in the form of using an operating microscope. We have microscopes which will give us good magnification. The person who needs the cleaning also will be comfortably lying on a table, couch, and then we can actually examine the ear under magnification and get the whole thing suctioned out in a slow magnified manner, so that inadvertent injuries to either the skin of the canal or the eardrum can be prevented. Now there is another technique by which we remove wax. It is called syringing. Now in syringing, we use water. The water needs to be at body temperature, at least lukewarm, and then we use a syringe filled with that lukewarm liquid. Usually we use normal saline. Some people use warm water, and then we can push it into the ear canal, and because the water gushes into the ear, it can actually wash out the entire wax outside. This is something which I rarely resort to because of risk of injury to the canal skin and the eardrum, because it's not a completely visible procedure. Part of it is a blind procedure. And second, water in the ear, sometimes if the person has an underlying hole in the eardrum or something, can trigger off an infection. My choice of equipment and procedure is to do it under the microscope using either a hook or suction.